Cirrhosis is a very interesting setting because it's complicated by bleeding. But in the last 2 decades, many studies show that it may also be complicated by thrombosis in the portal vein circulation. To give you an idea of the prevalence of this complication, Cirrhosis will show you data regarding a registry we performed in my country, in Italy, in which we included more than 700 patients with cirrhosis, the etiology of which was viral in 44% of the case, alcoholic in 25%, and other cause in 31%. The severity of the disease was low in more than 50% of the case, and more severe in 47%. What about portal vein thrombosis? Using the Doppler ultrasonography, we show that the prevalence of portal vein thrombosis was 70%, which means that it's not so rare, and it should be diagnosed, particularly because in more than half cases, cirrhosis is portal vein thrombosis is asymptomatic. Other clinical presentations are ascites, gastrointestinal bleeding, and etc. What about the localization? Localization is prevalent in the portal vein trunk. Multiple sites is in more than 30% of the case. But the message of the study is in more than 90%, PVT, portal vein thrombosis, was non-occlusive or incomplete. So what's the behavior of a clinician in case of PVT presentation? The message for this study is that in most cases clinicians are not willing to treat with anticoagulants because probably they are scared of bleeding complication. And so these patients are left without any therapy. So to address the issue, if anticoagulant may be safe and useful to treat the PVT, we performed a meta-analysis in which we analyzed 3 issues. The first one was anticoagulant, which were warfarin or low molecular weight heparin, are effective in recanalizing thrombosis in the portal vein, and the answer is yes. The second, you see the odds ratio is positive in favor of anticoagulant. The second message is anticoagulant useful to reduce progression? And again, the answer is yes. And the third point we look for was there is any increase in bleeding complication, and the answer was no. And paradoxically, we observe a reduction of variceal bleeding in this meta-analysis. So, what can we conclude from this study? The first conclusion is the limitation. Limitation of the study is the sample size of the meta-analysis is small, so we need more data to support this study, these results. Of course, the implication is that anticoagulant may be useful to reduce the risk of thrombosis and its complication. But the final message that we need to perform randomized clinical trial to address this issue in order to support this result, which apparently are good.